I know that there are a zillion exercise ideas out there on the internet, and it can be hard to choose which ones you should be doing and at what time you should be doing them. I'm Dr. Christina, the Picky PT, and my mission is to educate you more on your body and on the purposes of exercises and how to be picky about how you do them. So that way you can get the most out of these exercises and the most out of keeping your body as healthy as possible, especially when you're recovering from something like having a baby and you're trying to return to running. So if you like the idea of learning about more content like this, make sure to like and subscribe to this channel so you don't ever miss out on my new videos and you can continue to learn more about your body and how to take better care of it. So today, I'm gonna go over 3 exercises that I've seen on the internet. They're a little bit interesting looking and maybe they've caught your attention like they caught mine. I wanna explain to you what their purpose is, how they can be helpful to you, and how to be picky about how you do them. So let's start with the first exercise, which is going to be working on opening up the back of your pelvic floor, but using resistance to do that. The second exercise is going to be doing a landmine lift that you may have seen in the gym, but doing it sideways, which is going to help to strengthen the outside of your pelvic floor. And lastly, we're going to do an exercise that is going to work on your core strength, not just the up and down six-pack muscles, but those oblique muscles that you need in order to heal something like a diastasis recti or pull in that mommy pooch at the end of having a baby. So let's get started. So 3 populations that it's super common to have a tight pelvic floor are going to be women who have been pregnant, runners, and weightlifters. You can tell that your back of your pelvic floor is really tight if it's easy for you to sit cross-legged like this, but it's hard for you to sit with your leg turned in like this. You're lacking that internal rotation and opening up that pelvic floor. So imagine that tight pelvic floor in the back is going to rotate your legs out versus opening that pelvic floor is going to look like internal rotation and bringing those hips in. So this first exercise is going to involve using a foam roller and a TheraBand where you are laying on your side, you are keeping your legs in neutral and you're almost shearing them in order to open up your top pelvic floor, but we're gonna use the TheraBand here to add resistance because if you've already been doing this and you feel like you're ready for that next level, you can add a TheraBand for resistance to make it just a little bit harder. Okay, so you're going to lay on your side with your knees bent at about a 45-degree angle from your body. You're gonna place the foam roller between your knees so that way your legs stay parallel to each other and your top leg isn't caving in. You're gonna put a TheraBand around the back of your top knee and anchor it to something in front of you so you can pull against that resistance. Now, as you do this exercise, you're going to pull your pubic bone to your belly button to begin with, so you've got a nice lengthened back. You're going to relax your head in neutral. You don't want it lifted like this because otherwise you're going to be cued to overuse these side bending muscles on the top, which is not the goal of this exercise right now. So head relaxed, pubic bone to belly button, so you're in your pelvic tilt. And what we're gonna do is we're going to slide our top leg backwards using that foam roller against the resistance of the TheraBand, all right? What you're not gonna do is you're not gonna try to lift that top leg off the foam roller as you slide back. Imagine your femur bone staying parallel to your other femur bone and gliding backwards, opening up your bottom behind you, that top bottom, because that femur bone is sliding backwards and pushing it open, all right? So as you go further back, you're gonna pull into that pelvic tilt more, pulling in your abdomen more. And if you wanna add another level of challenge, you can even lift your bottom core, your bottom trunk off of the surface you're on. So you've got your external obliques engaged on this side, your pelvic tilt engaging your transverse abdominis, and then you're gliding backwards, not letting this drop, not losing your pelvic tilt. And you should feel an opening of your top glute, all right? Maybe even a stretch next to your tailbone and sacrum on that side. And that's how you know you're doing this right. So the second exercise is going to be doing sideways landmines. What you've probably seen people do landmines before is they're holding it with one arm, doing a lunge, and then pressing overhead as they come up, which is really great for strengthening your glutes, your shoulders. It's kind of an overall exercise, which is awesome. But if you are recovering from having a baby, or you are trying to get back into running, you will have some weakness in these outside hips, possibly from the fact that you are carrying that child now on your hip and popping that hip out. That leads to weakness over time in these muscles that keep your hip underneath you as you are landing, running, or even as you're walking and you don't want to have those hips dropping to the side each time you do so. So we're gonna set up our landmine bar with a plate closest to us. We're gonna bring it up, holding onto it with both hands. Our outside foot, we're gonna make sure the foot is in neutral, not turned out, not turned in, all right? Kind of do like a curtsy lunge, crossing the inner leg behind. And then we're gonna push up using our outer glute muscles right here to keep that hip underneath us as we do this, okay? What we're not gonna do is having that hip still hang out to the side. We wanna pull it in as we come up. And if we wanna add an additional challenge, we wanna think about pulling our core in, pubic bone to belly button as we do this. So we get a core exercise out of this too. One more thing to watch out for is as you're doing this front leg, you don't want that knee to be falling in or falling out as you curtsy lunge. You want that knee right in line with your foot as you're lunging back and then pushing up. So try it out and see if it is a good exercise and gives you a good burn right here. So the third exercise that I'm going to show you that caught my attention and maybe caught yours is doing a side plank, but with a combination of rotation in your trunk and a clamshell. This can be really helpful for strengthening your lateral or outside pelvic floor muscles, because remember, your pelvic floor is not just your sling muscles that go underneath you. It includes every muscle that attaches to your pelvis, including your outside glutes. So this is great for strengthening those muscles, plus it adds the additional challenge of strengthening your core and specifically your obliques, your rotational core, so the muscles that pull you in and across. If you are struggling with things like diastasis recti after having a baby, this is a great exercise to do. Once you've worked your way through the more basic versions of this exercise and you're ready for a challenge, you don't necessarily want to start off with this one because it is a more challenging exercise. And I'm always a proponent for better form over more challenging. So let's go ahead and show you this sideline plank with a clamshell. So you're going to lay on your side with your knees bent at about a 45-degree angle from your body. You're going to have your elbow directly underneath your shoulder. You don't want it too far out or too far under. You want it right underneath. You're going to lift up into that side plank, thinking about the fact that you're using these oblique muscles on this side to lift that core away from the floor. Then you're going to put yourself in a clamshell position, opening that top hip, but keeping your feet together. Now, here's the addition of the core to this exercise. You're gonna rotate down and rotate up repeatedly. When you do this though, what I do not wanna see you do is I don't wanna see you flaring your ribs as you rotate down. You wanna think about pulling in your entire core from your pubic bone to your belly button and your ribs straight back to your spine. As you rotate down, imagining that you almost want to have a rounded back behind you. And then as you come up, you don't want to arch your back to come up or flare your ribs. You want to keep that stacked core. So we're rotating down, pulling everything in. And as we rotate up, we're still pulling everything in, okay? It may mean that your range of motion is less, but I'd rather it be less and you're doing better form than going bigger and you're doing it with bad form. If you're doing this correctly, you're gonna feel a burn in the outer part of your hips on both sides, and you should feel some work being done in your core as well. So remember, it's very common for someone to have a tight pelvic floor or weak pelvic floor after having a baby. Runners often have issues with their pelvic floor, and weightlifters have issues with their pelvic floor. So if you're trying to get back to either of those activities after having a baby, these are 3 exercise ideas that would be great for you to try in order to gain the opening of your pelvic floor and gain the strength of your outer pelvic floor that you need to return to those activities. If you try these out, and these exercises alone are not helping you solve your issues, then make sure to reach out to a neuromuscular expert, a physical therapist who can create a personalized exercise program for you and also do some hands-on treatment that you might need in order to release those pesky pelvic floor muscles that just don't want to let go after going through a trauma such as birth.